So today we have a couple guests in here. Myself, I guess, as a guest. Now we pronounce your name DeNoy, is that correct?
DeNoy, yes.
DeNoy, all right. So we are at Jacksonville University doing the first official podcast in the Digital Literacy Lab. We have Josh Savage, or Joshua, what do you prefer?
Joshua.
Professional. Professional, okay. So we are basically in here because we're both clients of Ashley, and I keep, prodding her to come in and just have a conversation about what she does. We got to know her over the course, I got to know her over the course of it's been a couple of years, right?
Something like that, yeah.
Yeah, a few years. She is a massage therapist. Is that the official name?
That is the official name.
All right, so she's definitely, one to be reckoned with. But long story short, we're all clients of hers, and like some people have always had those horror stories about massage therapy, and we're not like that. We always come with the goods and the positivity on how these, how her techniques have helped us. Mm-hmm. So we're going to basically just go around. I'll give you a little intro on myself. Again, my name is Matthew Pate. I'm a learning technology administrator here at Jacksonville University. And we are opening a digital literacy lab, and our first podcast is going to basically represent Ashley and what she does for the city of Jacksonville, although she's a small business owner and by herself, and I won't use any misphrasement, but she's wonderful at what she does. She'll explain a couple things. We're just going to do a little Q&A so everybody gets used to understanding what she does and not just the common masseuse you would get somewhere on the street corner. So Ashley, if you would introduce yourself.
Yeah. My name is Ashley DeNoy. I am a licensed massage therapist here in Jacksonville, Florida. I've been a therapist for 2 years now. I specialize in what's called cranial structural therapy, working kind of with the head in relation to the rest of the body and promoting wellness throughout the body with the head and just whatever different issues present itself as life throws stuff at us, and I with that.
No doubt. All right, so Ashley, when I just got some questions. I always, not that I'm going to throw you under the bus, but you always intrigue me by some of the comments that we have or the conversations, as you said, that we have during our sessions. And you mentioned at the very beginning, like you were talking about cranial sacral, and I know that's something that not many people tend to understand what that is. Can you kind of describe what that entails?
Sure. So, yeah, cranial sacral or cranial structural therapy. If you think about your head, it works with the head. And if you think about the different bones in your head being like puzzle pieces, right? And when you put a puzzle piece together, they should fit nicely together, and that's how your bones should be. And when, you go through life, or even at birth, you have some trauma at birth, or, whatever, life just, you fall off your bike, you fall down the stairs, you get hit in the head with a bat, all that stuff can, move those bones, those puzzle pieces out of alignment. And that's when you can start to have some issues like headaches, or you might, bad migraines, or, different trouble sleeping, that type of thing. So cranial structural therapy kind of addresses those puzzle pieces being out of alignment and not working in unison like they should be. With cranial, the goal is to get the body working together so that a lot of therapists, they stop at the shoulders, they stop at the neck, they never go above, the collarbone, or if they do the neck, they'll do just something to feel good, but they never address the head, and the head is where the brain is, right? And that controls the entire body, right? So,
but why do you think that is, though? Is that just something that they're scared of hurting somebody?
Like a liability thing?
Right. So liability, sure. Being scared and just not knowing, that not even really thinking about, because they don't, in massage school, they don't get talk about, we learn about the bones, we learn about the brain, but we don't learn about how to help the bones of the brain, or how that can help the rest of the body, making sure that that's all working like it needs to.
So you're more like a specialist in that?
Exactly. Okay. Exactly. Yeah. It's I specialize a lot in just in that, all that, just working together. Let's see something else. You were saying, yeah. So people don't know about it a lot of times because it was thought actually that the bones in the head, they don't move. They have these things called sutures, right? That basically, if you look at it, it's like it almost looks like it's like some sewing stitches together. And they thought like, those bones don't move. But the reason they thought they didn't move is because cadavers is what the people study cadavers. Now, when you're dead, nothing's going to move, right?
Of course.
So, but they found that actually when when they looked on, people who were alive, and they found that those bones do move. Now, and when I say move, I'm not talking about, you're moving your arm or moving whatever. It's very slight, but it's just enough that when those bones move properly like they should be, it causes what's called, I like to call it the bathwater of the brain and spine.
Right.
The true name for it is your cerebral spinal fluid, basically. It goes up and down your spine 14 to 16 times a minute. And it washes out all those, toxins, clears up the neural pathways, because you have all your, your nerves kind of coming in on the spine and going out to the rest of your body, right? So making sure that those bones moving and quote unquote pumping like they should be, and getting that bath water up and through the spine and through the brain, that is key in making sure that the rest of the body is functioning, neurologically. The muscles are doing what they do. They're turned, quote unquote turned on and working like they need to. And then, like I said, when you get hit in the head, something happens, it makes it so that bathwater doesn't flush, up and down the spine and through the brain and filter out all the bad things like it should be. And that's, you can have PTSD, you can have insomnia, you can have migraines, all these different things that can be helped. And notice I'm not saying cured,
right,
but helped with getting those bones kind of back in place and all the tissues and the membranes back.
Yeah, I found it interesting because, as I mentioned when I first met you, my wife had that done years and years ago with balloons going up the nostrils. And we've never found anybody else from that point that would want to participate in that type of technique. And I know we mentioned before, you kind of do it differently where you do it in combination of the muscular stretching and all that, where you take two modalities and basically make them work, systematically together.
Exactly.
And I think that was I won't say it wasn't misleading to me. I didn't understand it, and I know from our particular session where you offered it to be able to shorten the duration and the pain.
Correct. Where
normally it would take me off the bad as we call it, tapping out.
I'm sorry.
No.
So does it so say you move the plates. Mm-hmm. I've heard Matt say this before. He's done it, and then you were able to get to a spot easily.
Exactly.
I wouldn't say, is it kind of sort of connected to how you're able to move a muscle or bones and stuff like that?
Yeah, absolutely. So one important distinction here, my license to even be able to do this work, I had to become a licensed massage therapist first, and that license gives me the authority and permission to move soft tissue, right? And just moving with not really bones necessarily, but when I say, let me rephrase, when I say bones in the head, yes, I'm affecting those bones, but I'm more working with the soft tissue that's covered over those bones, just to be clear, so there's no misunderstanding with that. So indirectly I'm working with those bones, and that's what's causing the good things to happen down the spine and through the nervous system and the rest of the body. But yes, it is specifically soft tissue that I'm licensed to work on. So going back to kind of your question, yes, so there are different places on the head and the cranium that correspond to different places on the body. Mm-hmm. Now, if any of our listeners are familiar with reflexology, it's kind of talking about the feet, where they push a specific place on the foot, and it kind of corresponds to the stomach or whatever. Kind of like that, just on the head. Okay. So, for example, the back of the head, if you have lower back pain or pain in your glutes, or more commonly known as your butt, right?
I'm listening.
You're going to work with the back of the head to help release the tissues back there, because that's going to correspond to any pain that you're having in your low back or your butt. One other example, between your eyebrows actually is cranially, that is the location of your C1, your very top vertebrae. So if that's out of place, that's causing you migraines, which very common, that's where a lot of migraines come from. You're going to work with the C1, and so you're going to I work not only cranially with the C1, but also directly I'll try to loosen up the tissue around the C1 as much as possible. So it's kind of your head. It's kind of a roadmap, honestly, with what everything you got in your body.
So I have a question for you, and I know I've asked this to you before. So most licensed massage therapists never get trained in this. How did you come across this?
Yeah, so
Because it's a rarity, and I know you met.
Sounds ancient.
Yeah, it's very, very. I guess Western medicines type, or I mean.
yeah, so there's this place called the institution called the Upledger Institute, and they kind of were the first ones to start looking into cranial therapy, and so from then there came a bunch of different people who kind of, it's kind of like when you play the game of telephone, you know how every message kind of gets a little bit, it changes a little bit and skewed off a little bit. So the Upledger Institute had, they're the kind of the first ones, and then they had students of theirs who would kind of go and look at it in different ways. And so there were, I guess it was about three different folks, a lady and a couple of gentlemen in Tampa, Florida, that were kind of exploring this in their own way. And I have a mentor actually who was trained by each of them in Tampa, Florida. And he kind of was a cherry picker, kind of in his own way. He learned from all of them, and then kind of like I'm doing. I'm putting a couple different type of therapies together and making them work with each other. He did the exact same thing, and so now he's just teaching me through that. So I actually did go and train in Tampa, Florida, with him and with the lady actually. She has her own clinic where she does this, and so I trained with her for. It was a series of workshops that I had to go do. I'm actually planning on going back and doing some more training because we never stop learning here. But yeah, so I learned it from him, and he's been kind of just teaching me as he goes, and I've been following him for going on 2 years now.
Okay.
Working with him and seeing his clients as he does it, and branching out and starting to take my own.
So quick question, and I'm always curious about like your success and failure stories. Was there ever a point where, like, when you're working on someone, whether they had a neurological condition or something that you just weren't sure about, that this cranial? Because the thing is, like I said before when I first met you, like, no matter how much I squeal and I'm not tapping out. You know what I mean? Because we always associate that we can't have a good massage unless it's painful.
Correct.
Where this is still kind of a learning process even for me, because you want to go in there and you feel like you want your money's worth, you better beat me up.
Right.
You know what I mean? Whereas the cranial, in conjunction with the physical movements of the body, that because obviously you're very strong, and being you're strong at the same time, you're also in there kind of feeling the body out with
Correct.
the cranial.
Mm-hmm.
It was just a curiosity that I had, that have you ever had, like, I don't want to say utter failure, but if, like, you feel like you went in there with something, all of a sudden it just didn't work? Because everyone has that in life,
Right.
but obviously that hasn't stopped you.
No. So what I'll say for that, cranially, it's my belief. Everyone goes through life and they get beat up in some way, whether it's a simple, like a bat to the head, or their sister punches, whatever. Life happens. I firmly believe that everyone can benefit from cranial therapy.
Yeah, I agree.
The question in today's society, we want, like you said, we want what we pay for. We want to see results. We want to see them now. We want them fast, and we want them to do something, just complete 180 for us and for our pain, our life, right?
Sure.
With cranial therapy, I have clients who do have, after one session, they're like, man, I feel lighter, I feel stronger, that pain that I've had is, 50% down, I feel like I can take on the world. A lot of times with guys, I'll have them come in for one session and they feel great after it and they never come back, because as a guy, we're good. We have 50%, pain's gone.
Yeah.
I don't need to come back to her
Sounds
again.
like me.
Some people they don't want to be consistent with their own, I guess, well-being.
Sure, and and that's one of those things that I think is key with this. Everyone's different, so the success, I believe it is a success with everyone. But when I say that, the measure by which we're going to measure that success isn't always necessarily something that you can see or feel.
Right.
Okay.
Right.
There's a lot going on in the body. I believe it benefits everybody. It's just some people are going to feel the benefits more immediate, or in a bigger way than other people might. And that's okay. That's okay. If someone comes to me and they say, let's do a session, and they do a session and they feel great afterward, or if they're, they feel great and they don't feel like they need to come back, that's okay. Your body, you're going to be able to feel what works for you. Other people, they come in for a session like, oh, great, when can I book again? Because they can feel the the goodness that that's doing.
I always find, though, which is interesting, is that, when I started like massages like 5-6 years ago, because I thought it was very foo-foo.
You're every other guy.
No, I'm just being honest with you. I mean,
Yeah.
I got so banged up that I was having vertigo and I was, blacking out.
Yeah.
And I wound up, at some point going, well, my muscular and my skeletal system it just feels like it's on edge, like it's stinging.
Mm-hmm.
That's the only way to describe it. And I started, obviously, getting monthly massages, and soon realized that, this isn't like an option anymore, because your health, you have it one time in your life, you lose your health, that's it, it's done. And you don't want to cause damage from, I'm not going to throw chiropractic under the bus,
Sure.
but I'm going to, because I know, and this is just my personal story, I have nothing against those people. But the fact that and I think we talked about this before, that I saw a chiropractor who became a friend of mine, but I saw him probably for a good 3 years. Mm-hmm. They did the same thing, crack, same maneuver, same this. And I always asked them, well, why do I have to come back to you like every 3 or 4 days?
Is it a business thing, or are you
No,
actually helping? It makes
Because
you think.
he didn't have an answer for me. He just said my body has memory, and it was basically, I move in the same position. We all tend to move in our own positions, because that's just where our bodies. Some people limp, some people have weird gaits,
Right.
And I always ask them, like, I almost feel worse. After the fact, not before. Before, you get that sense of relief because you got that bone to bone movement. You're like, oh, this is awesome, right?
Become dependent on it, right?
Become dependent on it, and next thing you know, 3 days later, I'm right back at his facility, and he's doing this exact same maneuver, and I'm going, no. And I was young. Don't get me wrong. I was very young at the time, and I'm kind of just trusting his mentality about, hey, and I respect him. I do respect the profession. Don't get me wrong.
Absolutely.
But it just became a hardship to realize that I'm paying this money for the maneuvers that don't work, and I'll be honest with you, I felt a nerve sting, if that even is a thing.
Yeah, sure.
A sting in my nervous system when he cracked me, almost like he's destroying nerve endings.
Yeah.
I felt that, and I'm like, I'm done.
Right.
Can't do this anymore. So the massage thing became secondary, and like we've said before, I must have gone through half a dozen people just that want to do their style, but don't really correct an issue that I have, and that tends to throw a lot of people away from massage therapy because they don't really see an improvement, whether it's a week, a month, and if you're chronic, you have to religiously keep coming back. But again, I mean, when I say religious, meaning you can do it every 3 months, 2 months, if you're really bad, every other week. But I always felt like massage therapy is not in perpetuity; it's maintenance to your body.
Correct.
Mm-hmm.
That's correct. That's absolutely correct. Yeah. Kind of going back to a little bit what you said about chiropractors. Again, I also have a huge respect for the profession and for those very intelligent folks over there. I will say, so as a general rule, and this is just a generalization, but chiropractors work with bones, right?
Yeah.
They're popping bones. They're they're moving them back and forth, and that's great. And that's sometimes what folks need, but a big rule that I was taught as I was just learning all of this is that muscles tell bones what to do. Bones don't tell muscles what to do. Okay? So, for example, you got let's just say you got some tight shoulders, and your chiropractor, he snaps something back into place. You feel great for the next, I don't know, for a few hours. Sometimes I've heard clients like, I feel great walking out his door. I go and sit in my car and I'm right back where I'm at.
Yeah.
And the reason for that is he snapped that bone back into place so that, the bones or the spine is where it should be, but the muscles that are attached to that spine are tight. They're going to pull that back
That's
out.
the whole point that's why, in my opinion, that they spasm.
Exactly.
Mm-hmm.
Yep.
Yep.
I
mean, I'm not speaking for everybody here, but
yeah,
you go through it, Josh. Yeah.
How I ended up learning about what you do was from Matt. And my thing is, I was going to the chiropractor 2 times a week.
Right.
And he's just cracking. I'm like, okay, I feel good.
Yeah.
I get back to my office after lunch. I'm like, oh.
You're right.
And I think one thing that you said, that resonated with me while I was there was the goal is to not see you again.
That is my goal. That is
that's
my
true.
goal. And that's my goal.
Who says that? Nobody says that.
No.
I mean, because you can kind of tell.
I'm not trying to see you again. That's straight what it is, and not because I don't like to see your smiling face. It's because I don't want you to have to keep coming back to me for the foreseeable future. No, that's not the goal. The goal is to get you healthy and to a place where
but even from a mental perspective, I think
That's a
and I'm gonna be honest with you,
phrase.
you don't sell yourself like you should. I mean, you don't. I'm one of those people. I'm like, dude, you gotta go see her. You have to go see her because.
It took like what 6 months.
Oh,
for
it
me to
took a
go?
while.
And
I
was
still
like,
get
go,
on his case.
go.
I'm like, you need to go in there and
I
give me your
must.
credit card so I can go ahead and set you up.
book something up.
Yeah, but it's odd because I'm one of those people where I got to see it to believe it.
Absolutely.
You know what I mean? And where, like I said, I'm older than all of you guys, so I speak from experience that I personally have thrown a lot of money away just with modalities that really become almost like snake oil.
Sure.
You know what I mean? And it's not, and I will say with massage therapy, it's, the way you handle yourself and the way you kind of explain things as you go along, and you always say, you're still learning in certain respects too. We have to, we all do.
Yes.
That it's important for people to know that, every case is different. Everybody is different. Some people can get, like you said, immediate correction, but knowing if you've already come in with that problem, it could be permanent, it could be temporary, it could be something that you just have to stay upon and make it, just like going out to dinner.
Right.
You have to, what's more important, your body or, well, I don't know, sometimes food's good though. But yeah, so yeah, Josh is one of those, he was another victim that I'm like, you got to go because this is not smoke and mirrors.
It's not. It's not. I contest. I went maybe 6 months ago,
Something like that.
Yeah.
and literally probably I'm not gonna lie. About a good week afterwards, you told me I'd be sore. I was like, nah, I'm fine. I woke up next morning and felt like I got punched in the gut.
Yeah, that is weird
But
how
my
that happens
back-
though.
My back
Yeah.
wasn't hurting.
Yeah.
And
Yeah.
I haven't been back because my back hasn't been hurting for that 6
Yeah.
months.
Yeah.
And I was like, okay, maybe I don't ever have to go back. But now I'm sitting here, I'm hearing the cranial thing. I'm like,
Well, now, and I had to tell him, I think I mentioned this to you yesterday, that you combine the modalities where you were under the assumption that it was one or the other, not
Yeah,
in
that's what I thought.
conjunction.
Right.
And that's, and I think people need to know that because you're going to make that decision. Because I know when you asked me the one time, can I do this to lessen the work,
Yeah.
on both of us? Because
Right.
like you remember, because people think, oh, it's just you working. I'm like, no, I have to breathe and feel the pain. I tell people that. There are
If you
two
don't
people
breathe,
working on this. You
ooh.
don't breathe, you don't get better.
Right. Right.
Because you can tell. You always correct me when I don't breathe, because I'm like I'm just holding tight, going, I don't know what's going to happen here, but
Right.
let's hope for the best. But I think that's something that like the audience really needs to understand at the end of the day that you're here to better them. And again, you're not one of those people that, hey, I'm going to sign you up for 10 sessions in a row, and I'll take your credit card in perpetuity.
No.
the
Absolutely
gimmick,
not.
you come back, do the same cracks or moves. and
Right.
then go. I feel
One
like it's
thing.
different.
Yeah, I'm sorry.
Absolutely.
But no, I was gonna say no. One thing, yeah, that's absolutely something that I actually intentionally try to not do because I know so many people, like you said, you go to the chiropractor, they do the exact same routine. It's like, great, see you next week, and take your money. I think I'm a very strong believer in every session should be one tailored to that individual client, and two, what that looks like is, maybe they don't have the same ache or the same pain that they had last week or last time they saw me. And so we're not just going to do the same stuff. Maybe we repeat a few things, that seem beneficial or that pertain to that new pain. Or if the pain, last time what we did just either didn't work or, they weren't comfortable with it. Whatever it was, we try something new, right? So we're always kind of reinventing, in a sense, to tailor each session to each client for what they need and what's best for them. So.
Yeah, I think the muscle memory is something that, you have. Again, this is just me talking. Our bodies have muscle memory. So when you're dealing with someone who knows what they're doing, it's always important for them to actually remember what your muscles actually do. Because I know with me, I always joke about my over 40 spot behind my back. Because it doesn't matter what I do, how I do it, when I do it, it's always going to be a problem.
Yeah. Yep.
And it's something that, and you've beat me up to the point where like Josh has mentioned, you feel like, oh, this person, she really hit me hard. And next thing you know, 3 days later, I'm like, oh man, I can't barely move.
Right.
Because you realize how impinged you were
Right.
and how tight you were. So a lot of that has, it's a personal experience. Like I've told so many people that you have to you have to take the ride, and trust.
Absolutely.
You have to trust people. You can't just, assume that they're all going to be the same.
Right. And I think another thing to say about cranial work is, like we've talked about, so cranial and, massage therapy, I'm working those together, but cranial, it doesn't have to be, I've definitely beat up on both of you for sure, because I know y'all can take it, right? But it doesn't, my youngest client that I've worked with was 2 weeks old, and I'm not working. I am not working.
How do you do that?
I would be afraid.
I am not beating up on them at all. It is, cranial therapy is a very, very low, very minimally invasive therapy in and of itself, right?
Yeah.
Now, when you add massage, and sometimes you just really, really need to get into a muscle and show it who's boss, right? But the cranial therapy itself, it's great for older people. It's great for, who can't take that pressure. It's great for young folks. Like I said, 2 weeks old. I mean, I was holding that baby's
That's
head just
incredible.
very, very gently. And at that age, a lot of it is very preventative, right? This specific client had been in a helmet and was actually recommended to come see, someone for cranial manipulation, just because their parents, they don't want it to grow in that shape the head took from being in the helmet, and they wanted to make sure that everything was working properly.
Is there ever a client that you refuse to work on in a sense of like age or disability, or just that you're afraid that maybe you're just not? I won't say you're not. Not that you're not qualified is the wrong word. Is there ever somebody that you're almost afraid to go and work with because of
Whatever they're
some
presenting.
parameter that's
Yeah.
just beyond your control?
So obviously things like brain injuries.
Okay.
I have worked with a client who had some brain. She had some brain damage, but it was a very long. It was that she had this for a while. She was still fully functional in terms of she can speak and she can. She can move, and it wasn't like that. But I'm not going to get you in my office 1 week after you have some crazy crash in your heads on pavement or whatever. I'm definitely not going to have you in my office then. But so yeah, stuff like that. Absolutely no. I'm not going to work with your head.
Well,
like that,
obviously
but-
you know their backgrounds. You're going to be able
Right.
to kind of figure out whether you want that.
Exactly. But
No,
yeah, other
that's-
than that, there's not, because it is so minimally invasive. There are very few people who I'm like, oh, let's not.
Yeah, no, I can see that. I mean, it's one of those things where you have to get to know the person and really kind of respond in that direction, based on what their needs are, because I know, like I said, you've worked on my wife, and my wife is an absolute Pandora's box of good stuff.
Always a good time with her.
Yeah, always a good time. So, and like I said, and she's one of those hardballers that, really at the end of the day, know what she wants, and she will walk out. She will walk out of there going, "Yeah, it didn't happen." You know what I mean? And like I said, the fact that she came back twice. Well, she's been a bunch of times. But I'm saying that she came back twice. I was like, "Oh, so how was it?" And she's like, "You're right." I'm like, "Oh, thank you. I won this battle in 28 years. I actually
You're
won.
welcome.
I'm awesome, right?" But yeah, no, that's good. And again, so let's just touch base on a couple things. I know we're kind of running here, but that's fine. So I noticed, like, with your website, you have like cupping, you have the standard, I call it the foo-foo massage. Mm-hmm. I know that's not the term, but the feel-good massage,
yes.
right? Feel-good massage. Of course, the more sports, I don't want to say sports, but injury-related type of
medical.
Yeah, hello,
Yeah.
couldn't get it out of my mouth. Thank you. So I kind of find you're very diverse in that, because it's not common that you find someone to kind of divvy up their skill sets, which is kind of cool, because I've done the cupping before too, and that is no joke.
Yeah, no, it opens up your clientele,
joke.
I imagine.
Mm-hmm. It does. It does
for
actually.
business.
Yeah. Mm-hmm.
It's very different, and it's not something that you see often either. I mean, usually it's something like one of those quote unquote clinics, that offer that, but
You'll only get something like that at a institution.
yeah, I
Like
think
on a
so.
sports team. in my
Yeah.
opinion.
Right. And so and just to clarify too, with cupping, yeah. So when our cupping, because there's the cupping that you do from, like, I think you find like Chinese acupuncture, right?
Right. I think so a lot of people see. Yeah.
Right. So with the cupping that I do, it really is. I mean, it is a cup, that you would find in, with Chinese acupuncture, that side of things. But it really is just more of a, some people just cannot handle the pressure that's needed to get that muscle released, right? And so when I, put a cup on, just add just a little bit of suction to that specific place and kind of just let it sit. It's just more of it's an easier way, and easier on them, honestly, easier on me, because my hands don't have to be going in there, like crazy to get it released. So just kind of a little added, pressure and again, suction, to get that muscle released.
Now,
and
does that help with the blood flow, I assume, in that area?
Absolutely.
Yeah.
Absolutely.
It's crazy because I've been doing all types of sports, and I guess I've never really known what the cupping was for, because they usually just like, okay, lay down on the table.
I got
Just
bruised
dig
from
right
that
in.
before because they left it on too long, or they maybe I don't know what they did. I want to say I want to say they left it on too long, but I got bruised from that one time. And
Like you got attacked by an octopus.
you're right.
Yeah.
I'm telling
Yep.
you.
Mhm.
And I literally was like, I'm never doing that again.
No. The cupping that I do, it's not. We're not that intense up in here. It's definitely more of a. I mean, I can put as many cups on you as you want. Well, as many as I have, but it's more of a.
Does that help break spasms?
Yeah, it
it's-
helps. Yep. It basically is just. It gives you a break from me constantly needing on you, with that muscle, because sometimes you just need a minute to chill.
I agree.
And it gives me a break with my hands too, so it's kind of a win-win with
No,
that.
absolutely. No, I just think it's nice to see the diversity of what you can do.
Thank you.
It's, I mean, you never have enough time to kind of experience all of it. I mean, I'm going to be honest with you, don't, because sometimes I know exactly what I want. You know what I mean? But yeah, no, that's you definitely have enlightened us. Let's put it that way on what the possibilities are. And you're young, which I find still kind of like a person that can do all this at such a young age. I mean, you got a long way to go with it, in the sense of what's next.
Yeah, I'm
Like
onward and upward.
Yeah. So
I have a question.
of course.
This might be a little, not personal, but personal. Yeah. I recently pulled my groin and was like out of it for a whole month.
Okay.
Like not even pulled, slight tear.
Okay.
First day off of crutches, shots and everything.
Mm-hmm.
And I feel like it just didn't do much. I mean, I can walk and put pressure on it now.
Right.
But do you think the cranial...
So you got shots for the groin pull?
Yeah.
Oh, I didn't know you did that. You didn't tell
It's
me
gonna be a
that.
conversation after
He didn't
this.
tell me that.
No.
No confidence. No confidence.
Yeah, 3 actually.
Shoot, man.
And
Dude, man, now you're sterile.
But my question is like, do you think that the cranial work in general, would you be able to work or help with like what would that actually do for that specific thing?
So, like I said earlier, there are different places on the cranium that correspond to different places on the body. Now, we'll have to put maybe a picture. I'm gonna have to put a picture on the website to kind of show what I'm talking about here. But not only are there, the top half, basically, if you think about the top half of your body, almost so works with the bottom half of your body. So a lot of times you have a shoulder issue, you're also gonna have a hip issue. Okay. Now, where I'm going with this is on your neck. The side of your neck is going to correspond to the side of your leg. So, I know, the eyebrows are up right now.
No, it's true.
Yeah, the
It's
side
true.
of your neck is going to
Don't
correspond
ask
to
me
the
how I
side
know.
of your leg. Now, what would follow with that is the inside of your neck corresponds to the inside of your leg. The muscles in there, so right up, with that where that groin's at,
That's
right?
insane. The right
So-
inside of my neck hurts.
And there
Oh,
is.
it does.
Yes.
And there it is. Yeah.
There you go.
So
The wizard
now-
has spoken.
My eye just twitched like that. Whoa.
So
Okay.
if you're the side of that side of your neck is very likely. Some people they don't feel it, so I'm going there and like, oh, that actually that hurts. Now I can't get into your neck, right? I can't get my hand in there, and pull
please.
that muscle out. I wish I could, to be easier, but no.
I wish
We're not going to do that. So what I would do in that case, and why it's very minimally invasive, is I would stretch it's your right leg, right? You're right, the right inside of your leg. We kind of get your knee out to the side. We get that muscle stretched, just a gentle stretch, nothing crazy.
Trust me, it's very strange when she does it, because you're like, you're being propped open.
It's a little yeah.
No, it's just.
I mean,
it's just,
as long as it works.
no, it works. Trust me.
Yeah. So you're kind of in half a butterfly position,
Exactly.
right?
I
Can't
And
even do that.
you're right. So after I'm done with you, you'll be able to,
Oh,
because
yeah.
we're going to be
No, seriously, because she'll show you your gait before, like, especially. I mean, I'm using myself as an example. she'll show the gait before, and as it's working, like mine was all funky, man. It was just like all over the place, and all of a sudden you start seeing it come in because my legs were like that, and they came in, and I was like,
Yeah.
what magic are you holding up? Are you holding my leg up? You know what I mean? So for you, that's interesting.
Yeah.
The neck course, that's very
The neck
interesting.
course.
We need to
like-
video this.
Yeah,
Wow.
we should.
Hey,
He can be the first experimental candidate.
There we go. There we go.
I'm game.
No. Yeah. So I would get your kind of your that area that I know you said
I'd be
you pulled
curious to
it,
see
right?
how that turns out.
Oh yeah, it'd be cool.
Yeah.
I get that muscle kind of stretch just gently, right? And then I would actually work on your head. And now when a lot of people are like, wait, I came in for my hip or I came in for my leg, why are you going on my head? And that's because with that, going back to that cerebral spinal fluid, the work that I'm doing on your head is getting that quote unquote that bath water moving like it needs to be. And when you have whatever muscle we're trying to pay attention to and get back where it needs to be and get moving and on like it's supposed to be, having that leg or that muscle in that position, it focuses you can call it energy, you can call it, it just focuses the attention on that specific part of your body to help it get back to the right length, get back to the right function, whatever. And so then after we're done with that, then we'll go back and we'll kind of, just test and see how your leg's working. And, if something's, Rome wasn't built in a day, right? So
okay.
sometimes it
Just
definitely does take a
true.
bit, but you should start to see even if it's
Yeah,
that
but
session. Or
there literally is immediate change. I mean, I'm again speaking from myself. So I know for you, you also have a month of scar tissue
Right.
that you have to contend with.
So, yeah.
Yeah.
And that's a big thing too because injuries are always going to be. You're going to have scars. It's a tear. I mean, let's be real.
That's me saying I'm going to book you.
There
Right.
you go.
Because
That's right.
Yeah.
It's insane.
Yeah. So absolutely, cranial can,
Cool.
cranial can definitely help with that. With what
We're
you
gonna
got on,
film
Josh.
this, guys.
Hopefully
Just kidding.
Hopefully I don't cry.
Yeah, you probably
We'll
will.
edit
No,
this
actually,
out.
I
We
don't
can
think
just
so.
edit that out,
I
right?
don't think so.
No.
Well, we'll see what Ashley has to say about that after the fact. We'll do some pre and post. It's like a football game. It'll be like the Super Bowl of fixing the groin muscle.
But like hearing that kind of, I said my eye twitch because it blows my mind that you said the inside of the neck.
You serious for feeling that? You're not BSing?
So serious.
Okay.
Like every morning I wake up trying to crack it. I don't think it's a cracking
Interesting.
It's not your
sensation
bones,
that I
it's
need.
your muscle,
It just doesn't go away. And it just so happened to happen the
Busted.
same time that the right side of my groin has been hurting.
Yep.
So that's
You sure your wife's not slapping you around at night in the back of that neck?
Right.
No, Josh. Bah.
that would be insane. But that's
Buy me a diamond ring.
very intriguing. Wow.
It is. No, well, listen, I'm telling you, we here and I always have very good conversation every time. And it's always a learning process. And that's and I don't think I've ever had that with someone who's actually beating on me I don't mean that in a bad way. That's working on me because there's always that state of, I have to learn about you, and then also she'll teach you, what she's doing while she's doing it. And that, believe it or not, sidebars you from actually
Even thinking
focusing
about
on the pain.
Yeah.
Right.
I don't know if you noticed that.
Oh, sometimes it's intentional. Not
No,
gonna
I
lie.
know that. I know, but I'm just saying. I think that is something that's interesting because very few people will do that because she'll literally have a conversation, stare at you in the eyes, and still work on you.
Oh yeah.
She's like a baker.
Oh yeah.
Baking, moving dough, and
One elbow in your
Yeah,
pec.
and I'm like-
Oh my gosh.
I'm like, well, because of the fact that would say that you're in tune with knowing how to control your hands to the body you're on. I mean.
Right.
Because that was the first thing when I first met her. I'm not going to throw the company under the bus, but when I first met her, I was like, "What is this?" Because same situation. You're being taught. You're learning. You're feeling the movements, but at the same time, she's almost explaining as to why it happened.
Right.
And how you need. Because she's always, of course, I'm guilty as charged. You need to stretch. You need to stretch. You need to stretch. It doesn't happen. It's like
We never
flossing
do.
your teeth. You know what I mean?
Oh man.
Sometimes
Do
you
the
want
day
to do it.
before.
Yeah,
The day
the day
before.
before.
Do the day before stretching like
Yeah,
that.
like that. Dennis
know.
doesn't know.
Yeah.
You didn't, floss for the last 6 months. Okay.
Yeah. No, that's you bring up a good point there with telling my clients, I like to educate them as much as they want to be educated. Some people come in there, they're like, you know what, fix me. I'm like, great. We can just listen to the music for the whole hour. We don't have, I'll just tell you what to do, and we can keep it minimal. But if a client wants to learn, and a lot of clients do, they want to understand the why and the how and the what can I do to prevent this, or what are you doing? I can get as technical with you as you would like, and we can all, we can
but it's nice to learn.
Like that. But yeah,
because it's your body. I mean, it's yours. You own it. You abuse it. You injure it. That's at least on my opinion, because I like to know what I just screwed up.
Sure.
Then I can
what
elaborate.
not to do.
Well, yeah. I mean,
Granted, it's going to happen.
That's exactly. You're going to get injured because you're active. I mean, that's just the way it is. I mean, you're active, you get injured, and here he comes with the crutch. But what are you going to do? Well, any other questions for Ashley? I mean, we covered a lot.
Would you say that your practices would save a person money over time versus going to I wouldn't say the doctor, because I go to the doctor.
Of course.
But other alternatives?
I would say, I mean, prices are rising right now. We all know this, prices for care. I would say overall, yes. It's one of those things that I wish I wish I could say yes. After 5 sessions with me, you can go run your marathon, you can go do your, whatever you want to do. I can't say that, unfortunately. I don't want to. One thing with me, I do not want to overpromise and underdeliver.
I'll say after one session, I was able to do like a 5-mile run. I'm so serious. After not being able to do it for 6 months.
All right. Well, there you go. And that's the way it is to some people. But some people they need that. They need to be consistent with it for 4 weeks.
But I think that's the biggest thing with any kind of self-help is that you have to know that this is not. You're not going to get this done in one session.
Rome was not built in a day.
And like I said, I mean, if we were to interview, I'm sure other people that you've had, they would, without even going in cold, I'm sure they would say the same thing.
Right.
Because you don't oversell yourself by any stretch of the imagination.
It's almost like you should do like a before and after, like a TikTok, and just like when they walk in, hi, this is so and so.
She's not good with computers, man. That's why.
I'm very.
So we have to help her out.
Technologically challenged. That's why I have Matt.
Yeah, no, we're gonna help her out.
I'm telling you, that'd be perfect.
No, I think that's a really good idea that you have there because remember, that would be really cool if we did the before and then wait a week.
That'd be fun.
Wait a week because it would be unfair,
Right.
Because I gotta tell you, I gotta tell you a funny story. So I was probably in my late 20s, and I went to go see a masseuse. You don't have to go, dude.
No, I'm good. I'm good.
So I went to go see one of my wife's masseuse, and this old dude, he was probably like in his early 70s, nice guy, but he swore he had the hands of God, right? So he worked on me, and as he was working on me, he's like, do you feel better? He kept telling me, like, putting in my head, hey, do you feel better? At the end of the session, he goes, how do you feel? And I'm like, I just looked at him, I'm like, what do you want me to say? I said, I don't feel any better, I'm sore.
Right.
But he swears his hands were like I said, the hands of God. I'm like, what just happened here? You know what I mean? And I told my wife, don't ever ask me to go back to this guy again, because he made me feel uncomfortable. Like I had to give him like the clap, yes, I'm so better. Jesus just saved me, and yes, I'm gonna come back 48 more times. No, I left. I literally ran out of that place. I'm like, no, because I almost felt like he was hurting me, and because he wanted that. Hey, because it hurts, I'm fixing you. Right. And I did tell you about my other one who was a blind guy. I won't throw him under the bus, but I had a masseuse who was blind. He was actually really good.
Oh, yeah.
But, and I'm gonna say this, which you're not like this. Because we became friendly or friend, I won't say friends, but friends within obviously distance, right? He started slacking off. And, as long as I've known you, it's been a couple of years now, right? A couple of years?
Something like that.
I'm losing track. I'm getting old. Sorry, guys.
Yeah.
Yeah, thanks, man. Appreciate it. So I don't feel it with you because I think, we have you have more of a truthful relationship. Does that make sense, right? There's no hidden agenda. And that's one thing I do like, just and how you run your shop in the sense that there's nothing hidden, and that's a very good quality about yourself. You're very sweet and innocent, but yet powerful and strong, and can definitely make your day miserable if you hit her wrong. So
like a slogan like I'll take down an elephant with my
Yeah.
thumb or something.
Right.
Oh, no,
Well,
she
no.
will.
My clients tell me, they say, I don't have kids yet, but they say when you do, you are never going to have to discipline them. You just need to know
She's gonna
right
show
where to
them
get them
the
in
thumb
Is
of
your
death.
room clean?
That's
Put my
insane.
thumb in their cap.
She's gonna just take her eyebrow and twist it, and that's it. Done.
Done.
Go do your chores, child. Yeah. You're gonna learn that Spock maneuver on your
Right.
neck.
I've always seen the videos and they touch a pressure point and just drop.
Oh yeah.
Yep.
Dude, that's those fake church videos you see when the Holy Ghost goes in them. Yeah, man. Anyway, all right, Ashley, thank you for coming by. I will do my best on this, but yeah, that was fun. I enjoyed that,
That's good.
and we got a lot of information out. I think as we go on, we'll kind of look at maybe taking some areas and just kind of shortening them up and be a little bit more precise with them, just so people can know. And at some point down the road, I'm sure there's going to be questions coming up, and definitely would be really cool to have interviews even here at JU with Lacey and the girls for she's dance, right?
Yeah.
She's working with to try to get some of them. Yeah, because Lacey's gone to her and she's worked on some of the hard cases of the dancers.
I just did cranial with Lacey.
Yeah.
And she sent me a text. She
Feels
sent-
great.
It
Like,
was her first time. It was her
Yeah,
first
little
time
Lacey
having
too,
yeah.
cranial.
Yeah.
Her first time having cranial. She's like, just the next day, she's like, just to let you know, I am absolutely amazed. I have no burning today. I feel so much more balanced and even. I forgot how this felt to move and not feel restricted.
Yeah,
Appreciate you and your work so much.
It's gonna blow her mind when we're in this program here
Mm-hmm.
where we work out after.
It's
after
Bracken,
school.
right? Her last name,
Yeah,
Bracken?
mhm, Bracken, yeah.
We work out after school,
Yeah.
after here, and I'm gonna be like, Ashley. She's like,
Oh, yeah.
yeah,
The Messiah.
That's insane to hear, though.
Yeah.
No, yeah, but that's the whole small world effect. Because actually, I met Lacey when I first came here at JU. I was singing in a workshop. I didn't know, my head from my toe.
Mm-hmm.
I'm fresh out of wherever retirement per se, and Lacey. I was hoping Lacey was something in Blackboard, and we just started chatting because she was pregnant at the time.
Mm-hmm.
And she's like, "Oh my God, I'm in so much pain." Blah 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 blah. Did you see her when she was pregnant?
I did not.
Okay.
No.
Oh, that's right, because I kept asking you about, did Lacey come see you? And you're
Yes.
like, no. And this was months. I guess she had to, once she gave
Yeah.
birth.
Yep.
So I told Lacey, we were just talking about physicality and things of that nature because she's into the dance and blah, blah, blah. So not that I'm a dancer, just
No, I would not accuse
I
you
am
of
not a
that.
dancer.
Okay.
only when I drink. I'm just kidding.
I'd like to see that.
Bleep. No, just kidding. At least that's what my wife says anyway. So I told her about you, and that's why I kept bugging you. I'm like, how she spoke to you, because she's in that field where people get injured.
Yep.
And
Man,
yeah, it's a small world. Let me tell you, it's a small
it
world,
was a
and it's
live
not.
testimonial. Literally. You,
Yeah.
Yeah.
you said what, yesterday or
Yeah,
2 days
the other-
ago?
I saw it. It's probably maybe a week or two now.
Oh, so really,
Yeah,
that she
it's
got the
been
real
recent.
full
Yeah.
effect of.
Yeah.
Yeah.
Wow.
I think it'd be wise to do, even if we maybe do another session with just call-in testimonial. We can do it right here. I mean,
Okay.
because we can get them on screen.
Okay.
Yeah, that'd be kind of cool, because I don't want anything ever scripted, in
No.
a sense, and anything like, hey, you must say that to, because I think the reality of what we're trying to get across here, at least during the first podcast, is what your style of
A
massage
business and a
therapy.
practice is
Yeah.
Yeah.
You're not. We're not here to So you must have a package of 10 at 10% off. No, it's not even about that. It's just you need real practical experience, and you need someone who knows what they're doing.
Right.
Period. Because that is not something that we can just find off the street. I guess you could say it that way, right? Anyway, all right, guys. Well, thank you for coming out. Any final words? Oh, your website.
Ooh,
yeah.
that's a good one. Yeah.
PostureWorksMandarin.com.
PostureWorksManager.com. Yeah.
Right?
Go check it
Yeah.
out.
Yep. That's how we book, and I'm always on that, seeing
Gonna be
what's going
using
on.
that.
I'm
Yeah.
sorry. What?
I look.
Oh.
He's already got it on his phone.
Already got it on your phone. All right.
He's written my credit card, put it in there, autopilot.
It's literally.
Yeah, no, it is.
It's right
It is
there.
on there.
Right.
Yeah.
I'm
All
telling
right.
you.
Look at that Studley website. I wonder who did that. All right. Well,
All right.
thanks again, Ashley.
Yeah,
We're going to
of
cut
course.
this off now. Thanks for coming out.
Thanks for having me.
Thank
All
you.
right.